This nasal spray is used to treat dryness inside the nose and help add moisture to dissolve and soften thick or crusty mucus. It is particularly helpful for babies and young children with stuffy noses who cannot blow their noses, as it makes the mucus easier to remove with a nasal bulb syringe, relieving stuffiness and making breathing easier. The product contains a purified gentle salt solution, also known as saline or sodium chloride solution, and does not contain any medication. It is safe for daily use and can be used at any time of the day as needed. When using Saline Nasal 0.65% spray aerosol, you should spray it into each nostril as needed or as directed by your doctor. You can also use it as drops or a stream. Make sure to follow all the directions on the product package and avoid touching the container tip to the inside of your nose. If your condition persists or worsens, or if you believe you have a serious medical issue, seek medical assistance immediately. Remember, if you have any questions about how to use this product, consult your doctor or pharmacist. Most people do not experience side effects when using this saline nasal spray. However, if your nose feels very dry and irritated, you may feel a stinging sensation. If this lasts or gets worse, it's important to talk to your doctor or pharmacist. If your doctor has recommended this medication for you, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience any serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. If you notice symptoms such as a rash, itching or swelling, severe dizziness, or difficulty breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before using Saline Nasal 0.65% spray aerosol, it's important to talk to your doctor or pharmacist if you have any allergies or if you are allergic to any of the ingredients in the spray. It's also important to let your doctor or dentist know about all the medications and products you are using before having surgery. The good news is that Saline Nasal 0.65% spray aerosol is safe to use during pregnancy and while breastfeeding. This means that it can provide relief for nasal congestion without any harmful effects on you or your baby. For optimal results, it is recommended to use the spray as directed by your doctor. Typically, the recommended daily dosage is 1 to 2 sprays in each nostril, and the best time to use the spray is usually in the morning and evening. Remember to follow the instructions on the label or as directed by your healthcare professional for the best results. Interactions with other medications can affect how well this nasal spray works or increase the chance of experiencing unwanted side effects. It's important to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication regimen without consulting your doctor first. There are no known cases of overdose with the use of Saline Nasal 0.65% spray aerosol. This makes it a safe option for relieving nasal congestion without the risk of taking too much. It is important to not share this saline nasal spray with others as it may increase the risk of infection. Saline Nasal 0.65% spray aerosol is used to relieve dry, irritated nasal passages. It helps to moisturize and clear the nasal passages, making it easier to breathe. This spray can also help reduce nasal congestion and improve the flow of mucus. It is recommended to use this spray 1 to 2 times per day, or as directed by your doctor. It is best to use the spray in the morning and evening for optimal relief. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep the medication out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. Properly dispose of the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.